Jo Poland. Prior to COVID, I was a very active volunteer coordinator for butterfly conservation. It was mainly in the outdoors, working with people, differing needs, doing practical conservation and monitoring butterflies and moths. My background is working with community organisations, and I'm passionate about butterflies. I got involved with HEPE in 2015, I think. Kat knew that I was working in the natural environment with volunteers, and she invited me to come to an event, which, as far as I remember, was about signage. I've been involved with so many different things with HEPE. It's hard to remember everything. But I think the highlights have been working with academics in fields that I knew nothing about, like virtual reality, helping a researcher who was looking at the possible benefits of bringing virtual reality into care homes. And we were able to put all the kit on and choose an experience to virtually be involved in. And I chose something that really scares me, which is going underwater. And it was fabulous, absolutely fabulous. That was a highlight. And we've done lots of work outside with community groups who don't experience nature in the way that one would possibly expect from people living in Cornwall, because lots of people don't have access to nature even though it's on their doorstep. So we've brought nature into communities by holding events around moth trapping, which is something that I'm very interested in. I respond to things that are sent to us online. That's one of the benefits of HEPE. You don't have to be at every meeting or at every interaction. You can just dip in and out, and nobody minds that. And I think that's one of its strengths. So if I get a moment and I've been sent something to have a look at that one of the researchers wants feedback on, I can do it whenever I like. And I think that's a great benefit to me because I can volunteer in a way that suits me. The backgrounds that the different people in the group have come from and the connections we've made with each other have been quite incredible, really. And Carol, who I met a couple of years ago at a HEPE meeting, we're currently working on something together around some diaries that I found, some very old diaries, over 100 years old. I was looking for a person who came from the village that the diaries were written in, and Carol popped up. And we're now bringing that into the community that she lives in and look at the benefits to that community of looking at their past. It's also very refreshing to see so many different types of people. One of the things that we often get accused of as members of HEPE is that we're not representative of the public. And I think that's quite interesting. And I think when the researchers look at what we actually do, they're quite shocked and surprised at the different ways in which we do the things we do. It's massive. The network that we cover, I've experienced now working with wildlife groups that I was working with, but also I'm now working with academics in areas that interest me because of the work that I do, particularly interesting work around Lyme's disease and ticks. That's something that's resonated with my own work and has helped me in my work keep my volunteers safe, because I had no idea Lyme disease is increasing in urban areas, and it's something that I wasn't taking seriously enough, actually. So that was an interesting learning experience both ways. Only this week I engaged with somebody who's introducing beavers into Cornwall, and we were looking at different areas of wildlife, and they wanted some advice on what butterflies and moths they'd got. She had absolutely no idea that ticks were so prevalent, and she's working in a place, got deer, and people don't take it seriously enough. You don't want to really scare people, but what you do need to do is just say, don't walk around with shorts on, because you're putting yourself at risk. You just need to wear long trousers and tuck them in. That's all. And it's not difficult, and you've reduced your risk of Lyme's disease, and that's simple, isn't it? And I hadn't realised how serious Lyme's was. And people also take my word more seriously if I say, who I learned that from? The top person on ticks in the country. You are able to speak with authority. And I think that's very confidence building for me as a woman. I always try and think about the work I do with HEPE and the research is when I'm in other rooms, as it were. And I think it's beneficial because people find it interesting to hear that the public are consulted about lots of very diverse things. And it brings a different dynamic to work.